Well, hello, this is Greg Downing with Texas Medicare Advisors here in crazy Austin, Texas. I'm a licensed insurance agent specializing in helping people sign up for Medicare and get the right Medicare supplement at the right price. Now, if you're like most of my clients, you're pretty dang confused about this whole process, and the more you read, the more confused you get. And so that's why when most of my clients come into my office, they pretty much look at me like a cow looking at a new gate. They don't know where to go, what to do, and I get it. That's why I put together my checklist. It is my Medicare checklist that describes exactly what I would do if I were turning 65, what you want to sign up for, why you want to sign up for it, how much it's going to cost you, and what your benefits are going to be. So let's just jump right into it. And let's start with, you got to have Medicare Part A. Now, your Medicare Part A, that basically takes care of your hospitalization coverage. And it's free. That's awesome because you've worked for it your whole life. So basically, as long as you've got 10 years of work history or your spouse does, then you're going to be eligible for Medicare Part A at 100%, no cost to you. Now, Part A does have a deductible of $114. No, $1,484 every time you get admitted to the hospital. So everything's not covered, all right? So you have some costs there, and what a lot of people don't realize is that if you're in the hospital for an extended period of time, you also have co-pays that you have to make, and they get up to like $742 a day, like I say, if you're in there for a long period of time. All right, so that's your Medicare Part A. The next thing you got to have is your Medicare Part B. Now, Medicare Part B, that's doctor visits, physician services, preventive care, and ambulance rides. Now, unless you're already getting your Social Security benefits, you're going to have to go online and sign up for your Medicare Part B. This doesn't happen automatically unless you're getting your Social Security benefits. All right, so you want to do this online basically 3 months before you turn 65. Now, for most folks, Part B is going to be $148.50 unless you are a high income earner. And then you're going to pay more because you know how it works. The more you make, the more the government's going to take. So if you are a high income earner and will continue to be one, then we need to talk about that. All right. Now, Medicare Part B basically pays 80% of everything, and you pay 20%, which is great unless you get a $50,000 bill from the doctors. So that's something you remember, and there's no end to that 20%. It goes on forever. If you got $1 million bill, you got to pay 20% of that. All right. Now, Medicare Part B does have a deductible, which you would probably need if you had to get in that ambulance, and that is $203 in 2021. So while your Medicare Parts A and B do provide great coverage, you still have a lot of exposure if you get sick. So that's why we need to get a Medigap plan or a Medicare supplement plan. Same thing, 2 words, just to make it even more confusing. Now, what does a Medicare Gap plan do? Well, it pays for your deductibles, your co-pays, and your co-insurance, so that you are basically out very little money. Now, the average cost for these plans runs about $100 a month. A lot of things depend on whether you're smoker, non-smoker, where you live, male, female. But just for the purpose of this, trying to give you some numbers to budget, look at about $100 a month. Now, other thing you got to get a Medicare Part D plan, or which is your drug plan. All right. Now, there's 35 of them to choose from. So how do you know which one's going to be best for you? Well, the only way you know for sure is by going to Medicare.gov, putting in your prescriptions that you're taking, and it will sort them based upon your premium and your copays to get you an annualized cost, and the lowest cost plan for you will pop up the first. So that's the way you find which Medicare Part D plan you'll want to use, when you turn to Medicare. All right, so if we just looked at this, then the cost, these plans run anywhere from $7.30 all the way up to $80. So the average person typically that I see pays about $15 a month for a drug plan. Again, budgeting purposes. So if we look at this, exactly what is it going to cost you to move to Medicare? Well, Medicare Part A is free. Medicare Part B for most folks is going to be $148.50. A Medigap's or supplement plan is going to be roughly $100. You get your Medicare Part D drug plan at around $15. Yeah, that'll make you dizzy. So you're looking at, $263.50. So that is your estimated cost moving to original Medicare, being able to see any doctor, any hospital in the country that you want without a referral, as long as they take Medicare. All right? So that's what you're looking at when you move to Medicare. Now, the other question always comes up is, what Medicare does not cover? So if you look at that good-looking guy in the middle, that is my, that was my 92-year-old dad who lived with me for the last 4 years of his life. Medicare doesn't cover long-term care. So one of the most stressful things I've done is try to manage my parents' long-term care needs because they didn't really tell me what they wanted. So I highly recommend that you get some kind of long-term care strategy in place because you're going to need it. Basically, 70% of us will need some type of long-term care. And Medicare does not cover that. All right? Now, also, it doesn't cover dental, vision, or hearing. So you either pay for that on your own, or if you want to get a plan that covers all those, that would be separately sold as a different insurance product, but those are available, and we have lots of them to choose from. All right, so that's what Medicare doesn't cover. Another thing that a lot of people have questions about is when to take my Social Security. Luckily, we have a guy that's got the same haircut that I do, and that's Roy Snarr. Roy he's been on TV and radio. He is one of, I think, around 100 people in Texas is actually certified as a National Social Security advisor. So he knows this stuff inside and out, and he's agreed to work with my clients to help you get a Social Security maximization report. So he can sit down with you and go through what your options are to make sure you're going to maximize your Social Security benefits when you take them. And also, he's an expert on long-term care planning. So that's after we get you all set up. Roy is available if you need help with that. He's agreed not to charge anything for that for my clients, and is an excellent resource as you look closer at how to manage all these things as you move into retirement. Well, all right, there you go. Here's your Medicare checklist. Now, if you're watching this video, you probably have this checklist attached to the email I sent you along with cost of Medicare gap plans or Medicare supplement plans for you to evaluate. And if not, there's my contact information. Greg Downing, Texas Medicare Advisors. I'm here to help you. And the beautiful thing is my service costs you zip nada nothing because I'm paid by the insurance companies to help you get a Medicare supplement that fits your needs and your budget. All right, have a blessed day and look forward to being of service to you.